the role of a breast pathologist is twofold. We start by looking at the specimen on gross examination, which means we will just look at how it appears. Are there any areas of suspicion? We'll sample those areas, okay? And then the second part is for us to look at it under the microscope, which is whereby we're able to determine whether this is a malignant lesion or a benign lesion, and ultimately offer a final diagnosis. Benign is usually a mass that is slow growing and usually confined to a particular organ, so has not spread to other places, usually asymptomatic. With malignant, however, these tend to be faster growing and typically will tend to spread to other areas, so usually the lymph nodes. So the way we determine whether a mass is benign or malignant, again, is twofold. So via gross examination, to mean how does it look to me as the pathologist when I look at this particular mass, and then how does it look under the microscope? So do these cells look sinister, or do they look more bland in appearance? And through that, we're able to determine whether it is benign, to mean slow growing, indolent, or malignant, to mean faster growing and more likely to spread to other organs. We are able to tell the care team whether the mass is benign or malignant. Because if a mass is benign, remember, slow growing, confined to one organ, not spreading, then that is a mass that will be managed more conservatively in comparison to one that is faster growing and more likely to spread outside of the organ that it has originated from. So as a pathologist, we're able to provide that information to the care team, and then thereafter they're able to plan how to move forward. Breast cancer, as you know, is the most common cancer in our women. And breast cancer will tend to vary in terms of how the patients will respond to treatment. And treatment is usually based on the hormone receptor as well as the HER2 status. So hormone receptor here means estrogen as well as progesterone. So if you have a patient, for example, with breast cancer that is expressing estrogen and progesterone, there is a specific treatment that you can use to target that and offer the patient a better chance at survival. If you have a patient who is expressing HER2, then there is a specific therapy that can be used to target that receptor. So we basically use these in order to guide management, but also to be able to determine how a patient will respond, how a patient's breast tumor will respond to therapy. So if a woman presents with a mass, the first question we need to answer is this mass indolent or is it more aggressive, to mean benign versus malignant? So pathology will answer that question. Once we've determined that this is a malignant mass, then pathology will determine what the hormone receptor status as well as the HER2 status of this tumor is, which will guide treatment for this patient. We will be able to give them targeted therapy. If we're able to target specific aspects of the tumor, it offers the patient a better chance at survival. And this is why pathology is considered the roadmap in treatment.